Hey all, welcome to Share Trek. Friends, today I want to talk about taking stock of news about our genomic companies. A few of them have made some news and most of it is good. So let's get started. Welcome back, friends. Let's first start with Crispr Therapeutics. As you all know, I have been quite bullish about this company for many reasons. First, it's got cash balance, which is pretty good. Second, they have multiple alliances in place, which literally outsources the risk of development to its partners. Third, they have a healthy pipelines with many candidates in FDA clinical trial. Last week, they got FDA Regenerative Medicine Advanced Therapy, which is called as RMAT designation for CTX130. And CTX130 treats cutaneous T-cell lymphoma, CTCL. CTX130 is also a wholly owned allogenic CAR T therapy for Crispr Therapeutics. You all know that I'm a fan of allogenic therapy, as it means the production and delivery of the therapy could fit the existing drug marketing and delivery methodology and infrastructure. Also, it allows the gap between when a patient needs the therapy and when it is delivered to be minimized. This leads to better patient outcomes, and this leads to better delivery of the therapy. And it takes away the entire logistics of collecting the patient's blood sample and working on it. So all that is removed. But the main problem for allogenic therapies are related to immune resistance, as well as there's a general problem with the excessive cytokines in the bloodstream with regard to CAR T therapies. So it will be interesting to see how Crispr Therapeutics navigates the FDA approval process to get a fully approved therapy. And also, in order to qualify for RMAT status, therapy must meet the definition of a regenerative medicine therapy, and also it has to be intended to treat, modify, reverse, or cure a serious condition, and should be supported by preliminary clinical evidence that RMAT candidate can address the clinical need. So CRISPR Therapeutics has met all of this for CTX130, and therefore it gets additional benefits of the RMAT designation, which is enabling FDA to give an accelerated approval of the therapy based on the surrogate endpoint or biomarker that can indicate clinical benefit rather than the clinical benefit itself. So that's another big positive. And basically, the chances of approval for CTX130, in my opinion, has improved significantly with the RMAT designation. So now let us look at another company, which is Verve Therapeutics. Last week, Verve announced that the clearance of clinical trial authorization from the UK Medicines and Healthcare Regulatory Authorities have been achieved for Verve 101. This is a very good news. This will enable Verve to commence clinical trials in UK for Verve 101. Verve already has a clinical trial enrolling patients in New Zealand for Verve 101. The clinical trial is called Heart-1 clinical trial in New Zealand, and it's designed to take approximately 40 adult patients with HeFH, which is a heterozygous familial hypercholesterolemia, and is expected to deliver data and results in 2023. So that is good progress out there. But we have to remember, Verve has a very slim pipeline with just 2 cholesterol targeting therapies. The success of Verve 101 is critical for the company's survival, in my personal opinion. Finally, let us look at Bluebird. Bluebird shares are still firm in this market because it has 2 FDA-approved therapies, but it has a weak balance sheet. We are all anxiously waiting to hear how it plans to commercialize both the therapies with such a tight budget. One possibility is that a big pharma may take over the therapies or the company, or pay Bluebird, or there may be equity dilution from Bluebird. In any event, the 2 therapies represent great value for the shareholders, so people who are holding the Bluebird shares are not likely to lose out much of the value out there. We have to still wait and see what happens. Bluebird has not yet spoken about any of its plans, so I'm anxiously looking forward to the Bluebird plans for commercializing these 2 therapies. They will have a material effect on the share price going forward. That, my friends, brings me to a mini roundup of the recent developments in some of the genomic companies that we have been tracking. I hope you liked this video, and if you did, please press a like out there. And if you're not yet subscribed, please subscribe and help me grow this channel. Thanks and have a great day. Bye for now.